Welcome to our college. Welcome to Ganja Medical College. I will teach you nursing in surgery, and today's lecture is bleeding. Bleeding is an actual problem in surgery. Bleeding is the escaping blood from the damaged or injured blood vessels. There are many types of bleeding. Arterial bleeding is the bleeding which blood comes from arterial vessels, and the color of blood is bright red, and bleeding is spurting with each heartbeat. Venous bleeding is less severe than arterial bleeding. Arterial bleeding is the most dangerous bleeding because the rapid loss blood. Venous bleeding is less severe than arterial bleeding, and venous bleeding occur from damaged venous vessels. The color of blood is dark red, and blood flow slowly, swiftly. Capillary bleeding is least severe bleeding. It can stop itself, and in capillary bleeding, blood oozes from the wound on the skin. There are internal and external bleeding too. In external bleeding, blood flow on the skin or membrane, mucous membrane. In internal bleeding, blood collects in internal organs or in tissue, among tissue. The other types of bleeding are mechanical and neurotrophic bleeding. In mechanical bleeding, the reason of mechanical bleeding is rupture and injured blood vessels, and in neurotrophic bleeding, bleeding happens in cause some disease. For example, scarlet fever, hemophilia, and other disease. There are primary and secondary bleeding too. In primary bleeding, bleeding happens just after injury, and in secondary bleeding, bleeding happens after any time. And physiological bleeding happens only in women from puberty period and continue to climateric period. Bleeding has common and local signs. The main signs of bleeding are paler skin or membrane, visual or mucous membrane, nausea, headache, weakness, dizziness, tachycardia, tachypnea, and decrease arterial and venous pressure, blurred vision, fainting, and progressive malaise, and other symptoms. The bleeding and internal bleeding can be also in abdominal bleeding. The rigid of abdominal wall, the rigidity of abdominal wall, pain in abdomen region, and bleeding may be as from natural opening, such as mouth, nose, vagina, rectum, urethra, and others. The laboratory investigations of bleeding, checking blood platelets, hemoglobin, and hematocrit levels of blood. The special diagnostic method include X-ray, ultrasound scanning, computerized tomography, and others. In internal bleeding may be used gastroscopy, colonoscopy, cystoscopy, arthroscopy, and other diagnostic methods. Treatment of bleeding is called hemostasis. There are two types of hemostasis: temporary hemostasis and definitive hemostasis. Temporary hemostasis includes the pressing direct pressure artery to the bone if the bleeding vessels located superficially and around the bone. For example, in bleeding of carotid artery, we may tracing carotid artery to the transversus processes of 6 cervical vertebrae. And in bleeding of subclavian artery, we can tracing there to first rib and other. And if bleeding continue, we can apply tourniquet in bleeding of extremity or limbs, especially in arterial bleeding. Tourniquet applied, turnstile applied above the valve, under the valve, and how long we stay tourniquet in summer for 2 hours, in winter 1.5 hours. We have to write note time when we apply tourniquet, because if we transfer, because if tourniquet stay long time, the tissue will be necrosed and disabled. And other methods of temporary hemostasis are wound package and elevate limb from level of heart and flexion some joints, for example, elbow and knee joints. There are four types of definitive hemostasis. There are mechanical, physical, chemical, and biological methods. The mechanical hemostasis includes the ligation of blood bleeding vessels and suture vessels. There are lateral suture and the circulation suture, blood vessels. The physical method include cold and high temperature because cold and or high temperature causes protein coagulation and this main reason of hemostasis. Chemical hemostasis include use some medicine for hemostasis. They are actually resorptive and topical action. This medicine include disinol, vicasol, etamizilat, aminocaponic acid, calcichlor, and chlor, and other thrombin, hemostatic sponge, and other preparates. The biological method include the transfusion blood, platelet mass, plasma, antihemophil globulin, vitamin K, and others. Thank you for attention. Have you any questions?